Hello and welcome to Modern Microbiology Academy. Today, we take a deep dive into AI in clinical diagnosis, understanding its current impact and its future implications for healthcare professionals. This is essential for those in laboratory sciences, radiology, nursing, and all allied health fields. View this not as a tech talk, but as a clinical reality check. Artificial intelligence is already in our hospitals, influencing decisions and patient outcomes. To frame our discussion, let's begin with an outline for today's lecture. First, in section 1, we'll build our foundation. We'll cut through the buzzwords to define what AI truly means in a clinical setting and ask the critical question, why does modern medicine so urgently need this tool? Then, in section 2, we'll move from theory to practice, exploring AI in diagnostic applications. This is where we see it in action, from interpreting scans and lab results to powering the decision support systems at your fingertips. But no tool is without its complexities. Section 3 will provide a clear eyed look at the impact, advantages, and critical barriers. We will weigh the proven benefits against the very real limitations and navigate the crucial ethical landscape that guides its use. Finally, Section 4 is about the human element and the path forward. This brings our focus back to you. We'll define the evolving role of the clinician in the AI era and explore what the future holds, ending with key takeaways for your practice. This is our roadmap. Let's begin our first section, the foundations of AI in healthcare. So, if we're all being honest, when you hear AI in healthcare, what's the first thing that comes to mind? A jumble of complicated buzzwords, a feeling that it's somehow important but vaguely intimidating? That's exactly where we start. Our first goal today is simple: to bridge that gap from abstract buzzwords right down to tangible bedside reality. We're translating the hype into your language because point 2 is crucial. We need to recognize AI for what it is right now, a present day clinical tool. This isn't science fiction. It's in your imaging suites, it's analyzing your lab results, and it's supporting decisions in your electronic health record. It's already here, and knowing that can be unsettling. So, our journey is about moving from any anxiety or uncertainty into a place of actionable understanding. My job is to give you the clarity to see this not as a threat, but as a transformative element of your profession. Which leads us to the central question we will answer. How is AI actively transforming the very foundations of diagnosis, and what does this transformation specifically mean for you, for your skills, your workflow, your critical role? By the end of this first section, that's what we'll achieve: a solid, grounded foundation in AI for healthcare. No fluff, just the essential understanding we need to build on for the rest of our talk. Let's get started. So, what exactly is artificial intelligence in our world? Let's clear up the biggest myth first. When we say AI here, we are not talking about a sentient, all knowing computer from a movie. Think of it instead as a highly specialized tool. It's as specialized as your PCR machine or your hematology analyzer, just for a different type of task. Its core strength: finding needles in haystacks, complex patterns in vast oceans of medical data, patterns that are simply too subtle, too buried, or too complex for even the most trained human eye to consistently catch. It does this by learning from millions of data points, countless images, lab results, and patient records. And this leads us to its true purpose. The goal is not to replace, but to augment and enhance human clinical expertise. It's designed to be the most diligent assistant you've ever had, one that never gets tired, can review 1,000 cases in seconds, and flags the critical ones for your expert attention. That's why it excels in specialized tasks, analyzing a pixel by pixel texture in a lung scan, predicting a patient's sepsis risk from vital signs, or extracting key findings from a dense clinical note. But here is the most important line and the mantra for our entire talk. AI provides data driven insights and probabilities. You provide the clinical judgment, the patient context, the empathy, and the final decision. It's not about the machine versus the clinician, it's about the clinician with the machine. That's the partnership we're here to understand. So we know what it is, a specialized tool. Now, let's tackle the why. Why is this not just an interesting innovation, but an absolute necessity for modern medicine? Look at the first point. The data volume is humanly impossible. Think about a single patient's journey today: genomic data, continuous monitoring streams, a lifetime of imaging archives, mountains of clinical notes. We are drowning in data but starving for insight. No clinician, no matter how brilliant, can synthesize it all unaided. This leads to point two. Diagnostic and treatment precision is now non negotiable. Close enough is no longer acceptable. In oncology, with targeted therapies, a millimeter's difference in a tumor's texture matters. In sepsis, an hour's delay is catastrophic. We need tools that operate at a level of speed and granularity that matches the complexity of modern disease. And we must face point three head on. Our systems are stretched, operational efficiency is critical. It's about workflow. AI can triage imaging cues, flagging critical cases first. It can screen lab results for urgent patterns. It automates the mundane, freeing up your most precious resource, time for complex decision making and patient care. This isn't just about working faster, it's about point four, the paradigm shift, moving from reactive, sick care to predictive and preventive health. AI can identify subtle early warning signals long before symptoms appear, allowing us to intervene when it's most effective. Finally, this is about standards and equity. AI offers point five, a path to reduce unwarranted variation in care. It provides a data driven, consistent second look that can help bridge gaps in access and expertise, raising the baseline of quality for every patient, everywhere. In short, modern medicine needs AI because our ambitions for care have surpassed the limits of unaided human cognition and our traditional systems. We need a partner to help us navigate this new complexity. That's the why. Let's get concrete. What does AI actually do in the diagnostic chain? Think of it not as a replacement for the diagnostician, but as a suite of new capabilities embedded in your workflow. First and foremost, it acts as the pattern recognition engine. Its core function is to detect the faint, multi-dimensional signals in data that our brains aren't wired to see. The almost invisible texture of a precancerous cell, or the complex interplay of 20 different lab values that whisper sepsis. This makes it perfectly suited to be the tireless first pass. Imagine it as an extra superhuman resident who can pre-read every scan, pre-screen every pathology slide, or review a night's worth of vital sign streams before morning rounds. It doesn't get fatigued. Its job is to triage: normal, urgent review, critical finding. Beyond flags, AI serves as the quantitative analyst. It doesn't just say this looks suspicious, it provides objective metrics. This lung nodule grew 1.2 millimeters in 90 days. Its texture score indicates a 92% probability of malignancy. It turns visual assessment into measurable, trackable data. This quantification feeds its role as the predictive layer. Artificial intelligence moves us from diagnosing what is to anticipating what could be. By analyzing patterns across millions of patient journeys, it can identify individuals at high risk for diabetic retinopathy, hospital acquired infection, or heart failure decompensation before the crisis occurs. Finally, in our fragmented data world, AI aims to be the unifying interpreter. A patient's story is told across imaging, labs, genomics, and clinical notes. AI works to connect these dots, surfacing a unified insight from the noise, giving you a more complete diagnostic picture. In essence, AI's role is to enhance every step from finding the signal to prioritizing the work to quantifying the finding, predicting the next chapter, and synthesizing the full story. It's the ultimate augmentation of the diagnostic craft. Let's focus on one of AI's most powerful arenas, the image itself. This, whether it's an X-ray, CT, or MRI, is a data-dense story, but key chapters can be written in pixels so faint they're almost invisible to the human eye. This is where AI becomes our most sensitive reader. Its primary role detecting subtle abnormalities earlier. We're talking about spotting a microfracture hidden by bone, or the earliest whispers of a tumor long before it becomes unmistakable. When seconds count, AI acts as a prioritization engine, instantly flagging critical cases like a hemorrhagic stroke or a collapsed lung to the top of the radiologist's work list. It doesn't just see, it triages with urgency. Beyond yes or no, it functions as a quantitative analyst. It doesn't just find a nodule, it measures its volume, texture, and growth rate with perfect objective consistency, reducing the variability that comes with human assessment. But let's be unequivocal. This is about enhancing, not replacing, the radiologist's expertise. Think of it as the ultimate resident, one that has reviewed millions of cases, sitting beside you, pointing to a subtle finding and saying, "Here, look closer at this." It amplifies your vision, refines your focus, and allows your profound expertise to be directed where it matters most. The final interpretation, the clinical correlation, the diagnosis, that profound human judgment remains and will always remain yours. Let's bring our focus into the laboratory, the true data engine of modern medicine. Here, diagnosis moves from pixels to patterns, from images to intricate streams of numerical and molecular data. AI's core strength here is uncovering hidden patterns. It can analyze hundreds of biomarkers simultaneously, spotting subtle correlations in a CBC or a mass spectrometry readout that might escape the human eye when reviewing data in isolation. It brings a new level of precision, automating complex analysis to reduce human error and variability. This means more consistent cell morphology identification, more accurate pathogen detection, and a higher standard of reproducible results. Perhaps most critically, it accelerates the detection of urgent findings. AI can instantly flag a critical alert, a drastically abnormal chemistry panel, or a blood culture turning positive, ensuring life-saving information reaches the clinician faster. Now, in an era of superbugs, one of its most powerful applications is predicting antibiotic resistance. By analyzing genetic markers and phenotypic data, AI can forecast a pathogen's resistance profile, helping to guide targeted, effective therapy days faster than traditional methods. Finally, it acts as a high-capacity interpreter for the most complex data we have. It can sift through thousands of genomic variants, compare them to global databases, and highlight the clinically significant mutations, transforming overwhelming data into an actionable diagnostic report. In essence, AI in the lab is about empowerment. It handles the volume and the velocity of data, from predicting resistance to interpreting genomes, so you, the pathologist, the lab scientist, can focus on the higher order expertise, integration, interpretation, and delivering the definitive diagnosis. Let's move to the very heart of clinical workflow, the moment of decision at the patient's bedside. This is where AI integrates as a clinical decision support system woven into the fabric of the EHR. Think of it as a guardian in the background. Its most vital function is providing real-time, life-saving alerts. By continuously analyzing streams of patient data, it can flag early signs of sepsis, predict acute deterioration, or warn of a dangerous drug interaction before it becomes a crisis. But it goes beyond alarms. It acts as a synthesizer, instantly cross-referencing a patient's unique profile against the latest medical literature and guidelines to suggest personalized evidence-based next steps. A key innovation, smart prioritization. Instead of adding to cognitive overload, intelligent AI learns to surface only the most critical and actionable insights, cutting through the noise so you can focus on the signal. In essence, it becomes a 24/7 safety net embedded in your EHR, offering a continuous data-driven second opinion. Yet, the final point is paramount. These systems are designed for augmentation, not automation. They present options, probabilities, and evidence. The clinician's expertise, experience, and knowledge of the patient remain the irreplaceable authority that makes the final call. The AI supports the decision, you own it. Now, we reach perhaps the most transformative application of all. This is where AI moves us beyond diagnosing what is to anticipating what could be. This is the shift from reactive medicine to truly predictive and preventive care. The core function here is identifying high-risk patients long before symptoms appear. AI analyzes subtle, complex patterns in a patient's history, genetics, and continuous monitoring data to calculate personalized risk scores. This isn't about crystal balls, it's about data-driven foresight. It means we can shift our entire model from waiting for disease to strike to intervening while it's still quiet. This enables true early intervention. We can personalize prevention plans, tailoring screenings, lifestyle modifications, and preemptive therapies to the individual's specific risk profile. To do this, AI excels at analyzing complex longitudinal data streams to perform sophisticated risk stratification. It helps answer who in my population needs my attention most urgently. Ultimately, this capability is transforming population health management. It allows healthcare systems to allocate resources smarter, improve outcomes at scale, and keep communities healthier. This is the future, not just better sickness care, but a smarter, data powered system for preserving health itself. We've talked about the how. Now, let's get to the ultimate why. What does all this actually translate to at the bedside? It comes down to one thing: tangible, measurable impact on patient outcomes. The evidence points to a direct chain reaction. First, Earlier and more accurate diagnoses mean treatment begins when it's most effective. This leads to a fundamental reduction in diagnostic errors and unwanted variability. AI acts as a consistent, objective second set of eyes, minimizing misses and standardizing quality. Think about the patient's journey. Shorter time to treatment doesn't just improve clinical metrics, it reduces immense anxiety and uncertainty. This efficiency creates a ripple effect: shorter hospital stays, fewer preventable complications, and reduced readmissions. Ultimately, this is what it's all about: improving long term survival and quality of life. By enabling precision, prevention, and timeliness, AI isn't just changing workflows, it's helping to write better outcomes. This is the real world impact we're all working toward. Having seen its impact, let's crystallize the definitive advantages. First, speed and scale. AI delivers analysis at a pace we physically cannot match. Second, superhuman sensitivity. Its pattern recognition operates at a granularity beyond our biological limits. Third, and crucially, objective consistency. It doesn't have a bad day. By applying the same rigorous standard to every single case, it reduces unwarranted variability and helps mitigate cognitive biases. Fourth, it offers continuous vigilance. It's a colleague that never sleeps. Finally, its power to synthesize. In a world of data silos, AI connects the dots. It merges the radiology finding with the latest lab trend and the genomic marker, providing a more complete picture. These advantages are about complementing intuition with formidable new capabilities, making our diagnostic systems faster, sharper, fairer, and more resilient. Now, with a clear view of its advantages, we must pivot with equal honesty. AI is a powerful tool, but it is not magic. To wield it responsibly, we must understand its very real limitations. First is its fundamental data dependency. An AI model is only as good, fair, and representative as the data it was trained on. Poor quality or biased historical data can perpetuate and even amplify existing healthcare disparities. Then there's the critical issue of the black box. Many advanced AI systems can't show their work. This lack of explainability is a direct conflict with clinical reasoning. Beyond the algorithm, practical integration is a major hurdle. If it disrupts your workflow, it becomes a burden, not a benefit. This leads to the unanswered questions of liability and regulation. If an AI assisted decision goes wrong, who is accountable? Finally, AI can be inflexible and costly. It excels at what it's seen before but may fail with a truly novel case. Acknowledging these challenges isn't pessimism, it's professionalism. It's how we move from naive adoption to critical, effective implementation. Beyond the technical challenges, we arrive at the most critical domain: the ethical and legal bedrock. Implementing AI isn't just an engineering problem, it's a test of our values. Foremost is the imperative to combat algorithmic bias and ensure fairness. If an AI is trained on a non representative population, its expertise becomes dangerous. This connects directly to the demand for transparency and explainability. We cannot accept a black box in clinical care. Trust requires understanding. Underpinning everything is the sacred duty of privacy and data security. Robust security isn't a feature, it's the foundation. This then leads to the unresolved legal frontier: liability and accountability. Clear frameworks are urgently needed. Finally, this changes our covenant with patients. We must evolve the practice of informed consent, respecting their autonomy in this new partnership. Navigating these considerations isn't a sidebar to implementation, it is implementation. It's how we ensure this powerful technology serves our enduring oaths. After navigating the capabilities and the cautions, we land on the most important question of all. So, what is your role? Let's be unequivocal. AI does not write you out of the story, it rewrites your role as more critical, not less. Your primary function evolves into being the final interpreter. Artificial intelligence provides data and probabilities, but you provide the synthesis, the wisdom. You remain the compassionate connector, the empathy, the reassurance, the conversation. This is your uncharted and irreplaceable domain. You must now also be the critical auditor. Your expertise is the essential check on the system. This requires stepping into a new dimension of leadership as the data savvy guide. You must understand its logic and limitations. Ultimately, this makes you the ethical steward. You are the frontline guardian. In the AI era, your role transcends being a user of technology. You become the collaborative conductor, the human anchor, and the ultimate authority. The goal is a clinician augmented by machine, achieving more than ever before. As we look ahead, the trajectory is a fundamental evolution. First, a direct response to our biggest ethical challenge, the rise of explainable AI, XAI. Transparency will become the standard, not the exception. This will be powered by seamless bidirectional integration with electronic health records. The result is true real-time diagnostic support at the point of care. This extends beyond the hospital with AI-assisted point-of-care testing, democratizing diagnostic expertise. Ultimately, this fuels a powerful wave of global health applications, making high-quality diagnosis a universal standard. The future is not a replacement, but a redefinition, a more seamless, intelligent, and equitable partnership. Your role will be to guide this partnership, ensuring it remains deeply human at its core. As we bring our session to a close, let's distill the journey into a few fundamental truths. First, AI is a transformative present day clinical tool. Its ultimate purpose, augmentation, not replacement. To get there, successful integration means actively navigating its challenges. This evolves your role into that of a director and an ethical steward, which leads us to the overarching vision. The future of diagnosis lies in a synergistic partnership. You are not passive observers of this change. You are its essential architects. Embrace learning, engage critically, and lead the way in building a diagnostic future that is not only more accurate and efficient, but remains deeply, unequivocally human. Thank you. Thank you for joining this deep dive into AI in clinical diagnosis. If you found this session valuable, please subscribe to Modern Microbiology Academy for more content on cutting edge topics. I want these discussions to be driven by you. Comment below and let me know. What critical topic should we explore next? Antimicrobial resistance strategies, the future of microbiome therapeutics, advances in point of care diagnostics? Tell me what matters most to our community. Your input will shape our next lecture. Until then, keep questioning, keep learning, and lead with expertise. Subscribe and let me know what's next. Thank you.